Hello. It's me again, obviously. This is my YouTube channel, so I'm the one making videos. It's almost 1 a.m. and I have been up since 4:30 a.m. That's like a lot. I think I mentioned it briefly in my last video. But I just stopped one of my medications, Seroquel, which helps with your sleep. So now my sleep is all over the place. I'm not tired, and I was trying to go to sleep and nada. So I thought I would just, pull out my camera and just talk, make a video, just like a talk vlog. I have really bad memory because of my medication, so I apologize if I've already said this. This channel is kind of going to be an intersectional channel about chronic illness that includes mental illness and other physiological illnesses, as I'm lucky to have both. I don't have my diagnosis yet for my physiological illness. We don't know what it is. I'm undergoing testing for Ehlers-Danlos syndrome, as well as POTS, which is postural orthostatic tachycardia syndrome. I do have several mental health diagnoses, which I'm not going to go into it right now. That's what I take medication for. I take 3 different psychiatric meds. So this last Friday, on January 4th, I graduated from my dialectical behavior therapy outpatient program after 4 months of being in that. In 2018, I was hospitalized 3 times. 3 different runs at outpatient programs. The first 2 were not very effective because I kept ending up back in the hospital. But this last one was really, really awesome. It's a little weird not to be doing it anymore because 4 months is a long time. You get in the habit of it's part of almost every day. I'm not going to miss the drive, though. Commute, traffic both ways, no thank you. Sorry about that. Totally lost my train of thought. I'm trying to think, like, timeline-wise. So I've always had anxiety for as long as I can remember about various things. It's kind of like split into more specifics, but also just generalized anxiety. My depression really started to kick in about 3 years ago. Which was after 4 years of really severe gastrointestinal issues that we could not find any reason for or any treatment for. I've always had pretty weak joints, also for as long as I can remember, progressively getting worse over time, pulling muscles more, twisting my ankle more, rolling my ankle more, falling, and then dealing with subluxations. I don't think it's been full dislocations, but not positive on that. Like, I remember the earliest physical problem I remember is when I was like 6 or 7, and I started having growing pains. Or they are what I was told were growing pains. I don't know if that is actually what they were, but they were awful. The pain was just bringing me to tears, unbearable, and there was nothing I could do about it. I guess I just had to like assume that that was what was normal and cope with it. I've also had chronic headaches for as long as I can remember. Over the last few years. Okay, I don't know, like 6 years ago? 7 years ago, I had my first migraine, which was awful. And I just had the one, and then months went by, and I had another one, and then less months went by, and fewer months went by, and then I had another one, and then they started becoming more and more regular. And now I'm at the point where I'm getting them multiple times a week, most of the time daily, and every headache is a migraine. So that's been fun, trying to find medication to help with that pain, because I can't function when I've got such a bad migraine. For as long as I can remember, I think that's a sign that these are things that I've been dealing with for a long time. Being prone to dizziness, and I had to be careful when I stood up, or when I sat up, or if I had leaned over to grab something when I stood back up, because I would get really dizzy and feel faint, and I have passed out a few times. It's hard to know what those were related to, because 2 of them were because of just excruciating stomach pain, so bad that I passed out. Again, that I haven't passed out in a few years, but those other symptoms have been getting worse and worse. Shortness of breath, my heart rate is crazy. It just goes all over the place, and I can hardly walk 10 feet without just being so extremely exhausted and out of breath, and I can't stand for long periods of time because I get dizzy, and showers are really hard because the heat intolerance is nasty, but at the same time the cold makes my joints hurt, so it's kind of like I don't really know how I'm supposed to cope with that. And then there's the fatigue, which is just all the time, so much, everything is just, I'm exhausted. I often can't make it through the day without a nap. Sorry about that, my camera battery was dying. Also, it's my puppy. He's so cute. So yeah, I took a really long time to get my psychiatric diagnoses. It took a massively serious dive to get people to take me seriously. And I'm dealing with the same thing with these other health issues now, is that doctors don't want to believe me that there's actually something wrong. And I know this is not just happening to me. This is, health invalidation around chronic illnesses, invisible illnesses, women with illnesses or rare illnesses, like, it's not, doctors don't really take the time to be accepting of that or care that much. That they run a test, the test comes back negative, they tell you you're fine, and so then you have to leave, and you're left with no more answers and just feeling really defeated. So that is definitely a challenge right now, especially because of my psychiatric diagnoses. It's a really easy way for doctors to brush me off. Like, oh, it's just your anxiety. Oh, it must be your medication. It's like, yeah, no, obviously that's the first place we went to, and it's not my medications. We tried messing around with all of them, and it did not do a damn thing. And if it is caused by my psychiatric issues, then why is it that over this year that I've worked so hard to get myself to a healthier mental state and have succeeded, why have the physical issues been getting worse? I don't know. People don't have an answer for that. So, that's where I'm at right now. I think I kind of totally rambled. We'll see if any of this makes sense. But yeah, I have an appointment with the cardiologist next week. Not this upcoming week, but the week after. I had an echocardiogram done, and I had a 2-week Holter monitor, which they've said nothing is wrong, but that's not true. My blood pressure is fine, and my heart structure is fine, and my heart rhythm is fine, but I'm not fine. My heart rate is out of control, unpredictable, and, you know, with chronic illness, you have to just learn to be a really strong advocate for yourself and not let doctors brush you off, which is hard to do. Very, very hard to do. Yeah, so the video is probably long enough now. I don't want to push it too much. So yeah, I hope what I just talked about made sense. I'll see you guys next time.